Come in.
Hi. Rosa, I'm Rhonda. I'm your healthcare provider. How are you today?
I'm all right.
Yeah? Would you like to do a little sanitizer on your hands? I always recommend this.
My hands are dirty.
Oh, I know. It's just kind of a habit that I have.
Do you have any more?
Yeah, absolutely. I've been a healthcare provider for about 15 years now. A little bit of my history.
Is this good for the face as well?
No, just your hands.
Oh.
It's actually clinically proven to remove germs better than washing with soap and water. So, you're Rosa. I read a little bit. Do you mind if I sit down?
Don't worry.
Okay. I read a little bit about why you're here today, but can you tell me why you're here today?
Let me see if I can remember. Oh yes, I have burning and itching on my side.
Okay.
It's unbearable, doctor.
Okay, how long has this been going on?
I'd like to say 6 years, but it's more like 2 or 3 days.
Okay. It must be quite painful if it feels like 6 years.
It's very painful.
So it's been happening for 2 or 3 days, and where's the itching at?
I just said on my side.
On your side. So you're pointing to your left side, so it's on your left side.
Right.
I'll be examining that in a little bit, but
Do I have to take off my clothes?
no, just your top, and I'll have a gown for you. We'll give you some privacy we'll give you some privacy to change into your gown. I'll let you know. So can you tell me how, you said you've been feeling this way for 2 to 3 days now. Have you noticed any fevers or any changes going on?
No, I'm
No.
tired.
Just tired.
But I'm tired all the time, so.
Okay. Okay. Tell me a little bit about your medical history. Have you ever been hospitalized or had any serious surgeries?
No, just for having children.
You've never been in the hospital. That's fantastic.
Well, just to get my shots and medication, you know.
Okay.
Say hello to a lot of people.
And Rosa, you're 74 years old and never been in the hospital. Wonderful.
74 years young.
That's right. Absolutely. I like your attitude.
Thank you.
Do you have any allergies to any medications?
Yes.
What would those be?
I am allergic to all the sulfa drugs.
Okay.
Beginning when I was about 45
Okay.
years old.
Okay. What current medications are you taking now?
Vitamins,
Okay.
calcium,
Okay.
you know, the whole shebang.
No medically prescribed from the doctor medications, just general vitamins and minerals and such.
Right.
Fantastic. I'm
That's what I
impressed.
say.
Tell me a little bit about your work that you've done, or are you retired?
Don't we wish? No, I'm not retired. I'm a kindergarten teacher. I would say I'm pretty successful at what I do.
Okay.
Otherwise, you know, only a fool would be teaching school at 74 years old. But I love what I do and energizes me, and kids are the answer to all life's problems.
Okay. They're, very knowledgeable.
Mhm.
Just take the time to listen
That's
to them.
right.
A lot of life lessons there,
Mhm.
I would think. So I want to take your vital signs. Okay, we'll start with that.
Okay.
Let me grab my blood pressure cuff. Just go over to my desk here. Okay, let's start off with your temperature. Under your tongue, please. Okay, you have a little bit of a temperature, 99.2. Have you noticed a temperature in the last few days?
You know, I haven't taken my temperature, so I wouldn't know, but I do feel a little bit warm.
Okay, yeah, you have a little bit of a temperature. Would you like to keep this? I only use one per patient. It just goes in the
Thanks.
garbage. You're welcome, absolutely. Since you're...
Can I have that too?
No, I'm sorry, I need this for my patients though.
I try.
Yeah, no doubt. So I'm going to take your blood pressure on your right arm since you're having some pain on your left side. I'd like to do it on your left. right.
I think it's wonderful that you have ducks in the back of your
I
office.
know, isn't it wonderful? And is the music okay with you? I like to put music on in my office.
Between that and the ducks, I'm one happy person.
Okay, I think it really sets the tone.
Yes, it does.
So I want you to relax your arm. Just relax it on your lap. And then when I'm taking your blood pressure, I just want you to kind of look forward. Don't turn to the side or do anything strenuous. Yeah, we have a pond in the back of our building and there's all kinds of ducks back there. So it's actually, the patients love it.
Isn't that duck saying quack, quack, quack?
Yeah, it's nice,
Okay.
isn't it? Okay. So just relax and look forward. Thank you. Okay. Your blood pressure, let me just grab my pen so I can write this down. Your blood pressure is wonderful. It's
Thank
123/73.
Well, I try to keep active and walk and, do the things that are necessary, one foot in front of the other at all times.
Yes. Relax your arm again. I'm just going to check your pulse.
Okay.
Your pulse is good. I'm going to listen to your heart and your lungs. Just listen to your heart. Nice and regular. Beautiful heartbeat.
Good.
Okay, now I want you to take a nice deep breath in for me. Another deep breath in. You pretend like you're blowing out a candle. Nice and clear. I'm not going to check your lungs on your left side quite yet because I want you to slip into the gown so I can take a look. But first I want to ask you a couple questions. You have a great respiratory rate, by the way.
Oh, thank you.
No problems there. How's your pain level? How's your pain been?
On a scale of 1 to 10, I'd say it's about a 7 or 8.
7 or 8?
Mhm.
Okay. So can you tell me if you've had any kind of cardiac history that you know of?
No.
No cardiac history?
No.
Okay, wonderful. So you have we'll look at your back here momentarily. Your lungs sound great. I want to just kind of feel your lymph nodes here, see if you have any swelling or... Nice. No issues. Any respiratory problems that you've ever had? Have you ever had pneumonia?
I have had pneumonia.
Tell me a little bit about that.
I had pneumonia when I was in my 30s,
Okay.
when I was quitting smoking.
Okay. Congratulations.
Thank you.
Sometimes a hard thing to overcome
Yes.
for people.
And then I had pneumonia in 2014, what was called walking pneumonia.
Okay.
And I worked the whole time I had pneumonia and took the antibiotics and came out of it.
Okay. All right. So now I'm going to have you step into your gown. I'll step out of the office for just a couple minutes so you can slip into your gown.
Mm-hmm.
Pausing for privacy for gown change.
Come in.
Rosa, you ready?
Yes.
Okay. Here's another. I have this really quirky habit of doing a lot of foaming because anytime you touch things or even change clothing, you're exposing yourself to potentially, germs. We'll just say I'm a germ bug fanatic.
Well, thank you.
You're welcome. You're welcome. So I'd like to take a look at your back. on your left side and see what's going on. So can I just,
Do you want me to stand up?
no, that's okay, you relax. You just kind of relax here and I'm going to take a look at what's going on. You said on your left side and your upper back.
Yes.
Okay. So I notice a significant rash. It looks like it's irritated. You have some redness there.
Mm-hmm.
I'm going to take a listen to your lungs on the right side, or the left side since I didn't do that earlier. I'll be gentle placing this on because I know you're sore.
Thank you.
A nice deep breath, please. Out. It's particularly red down here, so I'm going to gently push, but the coolness might actually feel good.
Okay.
Nice deep breath. Fantastic. Out. You have nice clear lungs.
Thank you.
So I'm really happy to see that. Can you tell me if you've had any kind of neuro pain?
What's that?
Like tingling sensations in your legs and your arms?
No.
No, okay. So you clearly have what's called shingles. It's an outbreak, but the good news is that it hasn't progressed. There's no blisters, because what shingles tends to do if it's not treated, good for you for coming in early, because we're at a good stage where we can take care of this so it doesn't progress any further. You have no blisters, which is good. That's when you're highly contagious. Do you have anyone in your family that's pregnant or immunocompromised right now? Say anyone with cancer or anything like that?
Not right now.
Okay.
Is this fatal?
No, absolutely not. Did you get your chicken pox shot at any time when you were young?
No, I had the chicken pox.
Oh, you had the chicken pox. Okay. I see you have a cane here. Can you tell me what that's about?
Well, yes, I was in a car accident in 1998, and my right leg flew up and hit the undercarriage of the steering wheel.
Okay.
So it weakened that area to begin with, and then just over the years, the arthritis has kind of settled in
Okay.
to my knee, and so in order to give me support when I'm walking, particularly for balance,
Okay.
I use a cane.
And the cane's helping you?
Oh yeah, for balance.
Okay.
Because, so I can, don't have to worry about falls at my age.
Well,
so-
you're still teaching, you said kindergarten?
Yes,
Wow. I'm so impressed.
most people are.
Yeah. So what we're going to do, shingles, a little bit about shingles. It's a viral infection. A lot of causes are stress related. If people are having an extra amount of stress in their lives, they'll have a shingles outbreak. Have you been having an extra amount of stress lately?
No more than usual.
Okay.
Is it contagious?
Not now, not at this stage. So I'm glad that you're here and I'm glad we can treat this. If it were to progress any further, most likely you'd break out into these little blisters, and that's when it's very highly contagious. So I am going to give you the rest of the week off. Today's Wednesday. I am going to give you the rest of the week off. I'll write you a note. I just want you to rest and take it easy. You said that you had some fatigue, so I'm sure kindergartners keep you running and on your
Oh,
toes.
yes.
So I'm going to give you a couple days off just to stay home and relax, and I want you to start some medication that I'll give you. I have some handouts here for you too to read as well.
Okay.
Most people get shingles only once, but it is possible that you can get it 2 or 3 times, but we'll cross that bridge if we have to, and hopefully we don't have to cross that bridge. So some things that I want you to do is I want you to cover that rash. I will give you some dressing supplies over on my desk. Try to avoid touching or scratching the rash.
Mm-hmm.
It just, will irritate. I want you to wash your hands frequently. Hopefully I've been a good example of that for you. I'll let you take that little sanitizer home with you.
Oh, thank you.
Yes, absolutely.
Where can I buy that?
You can't. That's only in the medical offices and hospitals. But
So,
I really shouldn't be giving it to you, but I'm going to.
could I keep making doctor's appointments so I could get one of those canisters?
Well, No, I'm just kind of doing this
Oh,
as a courtesy, and yeah,
that's nice.
because you asked me about it earlier. I just want to give it to you.
Okay.
So what I'm going to, one thing I didn't ask you about is your medications. No, we talked about your medications. You said you took.
Yes.
That's right. Okay, perfect. So I'm going to give you an antiviral medication called acyclovir. I'm just looking at some of the handouts that I'm going to give you to make sure it includes it on here. So I'm going to give you an 800 milligram dose. It's an oral dose, and I want you to take that 4 times a day for 7 days. So please take all of it. It's important that you take it till the end, till
Okay.
there's no pills left. Drink plenty of water. All this will be listed on this informative paperwork I'm going to give you.
Okay.
So start taking it. Make sure that you drink plenty of water. Taking this acyclovir will shorten the shingles. It will prevent it from progressing into the rash, or you have a rash, excuse me, into the blister phase. So make sure you take the whole dose. You can take some over-the-counter pain medicines if you'd like to for the pain. I think giving you a few days off will help you rest though.
Okay.
You can use calamine lotion, take oatmeal baths if you'd like.
It's like poison ivy?
No, the calamine lotion that we use for poison
Oh.
ivy, yes, same thing.
Okay.
You can apply that. That'll kind of take the edge off from that itching, tingling sensation. Try to reduce the amount of bad stress in your life. I'm sure thinking about retirement at the end of the year and kindergartners does cause some stress, but bad stress is not good. I don't want to say that stress is bad. Some stress is really good for you. It drives you, it motivates you, it keeps you moving forward.
I've managed.
Absolutely. Also, the thing about shingles is much higher prevalence in women than men. So, yeah, all this will be on your paperwork here.
Okay.
So once that shingles clears up, I want you to make it a return appointment. Let's give it at least 3 weeks or so. So we have a shingles shot out. It's called Zotavax. It's Zostavax. Zostavax. So I want you to get that injection. That's listed on here, and it says on the paperwork to please return within 3 weeks if everything's cleared up. And this is a preferred vaccine for people 50 years or older, and 74, you're good to take this.
Okay.
Let me see what else this says as far as, I think we've covered everything else.
I have a question.
Yes, please.
Do you think I caught this from someone?
It could be. Have you noticed anyone that's had like any kind of blisters on their skin, or because it's highly contagious once it gets to the blister stage and they open up?
No. No one walks around without their shirt on.
Okay.
With the shirt off, so no, I haven't.
Okay. It can show on arms as well, exposed body parts. But like I said, stress is one of the major factors in the shingles outbreak.
I'll do my deep breathing exercises.
Do deep breathing,
Squeeze the
mindfulness.
lemon.
That's right. Mindfulness is so
Squeeze
important.
the lemon.
Do you have any other questions for me, Rosa?
When I come back from my next appointment, can I have another can of that? Is that in there?
I'll see what I can do for you.
Thank you.
Absolutely.
Thank you.
So I'm going to give you these the education that we've talked about. My phone number's at the bottom of the page. If you have any questions, I want you to call our office.
Do you have a voicemail?
I do. I will always answer you by email too, if that's preferred. My email address is there too.
Okay. Thank
Do
you.
you have any other questions for me?
No, I
Okay.
guess that covers it. Thank you. I'll do. My mother always said, "Do what the doctor says."
Yes,
An apple a day keeps the doctor away.
that's right.
Okay.
It was very nice to meet you.
You as well.
It's a pleasure.
Thank you.
Please take care of yourself. Let me get that hand sanitizer for you, and take it easy for the next few days,
I will, doctor.
please.
Thank
Okay.
you.